Sorry, Chair, there is a correction to that, I think. I don't know if Simon's going to say something, but owing to recent elections, it's now June Davison, isn't it, that is going to sit on behalf of iWalk, not Emily Brothers. Have you not been informed? Oh, she's here.
Very much welcome to you, June. You'll excuse us for not updating our membership, but we will do that after this meeting. You're very welcome today.
Yeah, I'll probably say this in Councillor Journey. So we've got terms of reference on the agenda. We'll talk about them there. But Councillor Stevens is the new Councillor Love because he's the lead member for. He's the deputy leader, the adult social care, housing, and public health rep.
We need to keep our thumbs up. Laura?
Thank you, Chair. Just to advise at 10:30, unfortunately, or shortly before, Councillor Stevens and I will need to pop out for 20 minutes. We've got the Central Government Department here looking at our housing services today. So we've got a short initial meeting with them. We couldn't reschedule, unfortunately.
I think that's an incredibly important meeting to go to, particularly with housing on the island. So absolutely, thank you for letting us know. So are we all finished with apologies? And yes. So if I move us on to the minutes, is everybody happy that the minutes are to be approved? And that will be the minutes from the 26th of January. Seemed a long time ago, but everybody's happy with that. So next, declarations of interest. Does anybody have anything particular to this agenda or anything they would like to raise? Thank you. Public question time. Do we have any questions from the public? None received and nobody present. Chairman's update is next. I've been given a couple of items which should be raised today. The first is we would very much like to welcome Darren Cattell to his new position as place-based director for the Hampshire and Isle of Wight ICB. I'm particularly delighted to welcome him as we are working together. We also welcome the appointment of Penny Emirate as Chief Exec of the Isle of Wight Trust. The other point on the Chairman's update is the ICB 5-year forward plan. As a health and wellbeing board, we've been given initial feedback. Emphasising the emphasis for the integrated care partnership and the board to take into account of the JSNA and health needs which are particular to the island. And I know that Simon's been working very hard on that, and we will both continue to make sure that they are not only raised but included. Thank you very much. So that moves us nicely onto the joint strategic needs update. I'm going to hand over to Simon, Director of Public Health. Thank you.
Thanks very much, Michelle. You've got a presentation in your pack. Apologies, I did it in a bit of a hurry. It was presented at a meeting while on slide two. There's a timeline of an agenda, but really, I just wanted to bring it to this board. We are the board that is responsible for producing and delivering the JSNA. In the main, that is undertaken by my team. An ask of the board is, could you identify people in your organisation to work and your teams to work with my team to really make sure the JSNA is fit for purpose and carry on meeting the needs so that we can plan health and care and wider services together. So following this meeting through Sarah, I'll do an ask and an email to colleagues, but please do identify people to work with us on that. We have presented this JSNA at the Isle of Wight Health and Care Plan, so I won't go in detail, but it is really just important to note, we have a significantly older population than England and actually many parts of the ICB. So it's really important that we understand that and the implications that that has on the provision of health and care services. Colleagues on the table will know that from delivery. But you just need to understand that. And the map on slide 5 really kind of shows it's not just, it's kind of distributed differently. And through the presentation, we've tried to highlight the differences of different populations around the island. So, for example, we know in freshwater, there's a lot of people with without central heating, yet they're in their own home. So actually, how does that impact on how we deliver health and care services, and what does that mean for demand and health issues for the population? We know we're not as diverse as the UK, but still we have pockets of populations that do not identify as white, and again they'll have different health needs. So really this document is there to provide high level information, and some people say, well, it doesn't provide the answers. If it doesn't provide the answers, it's for asking questions, so then come back and we can do some analysis and really try and deliver that. But I think I'll end with life expectancy. We have worse life expectancy on the island than in England, and it's really important we think about that and what we can do to improve life expectancy. Michelle, I'm happy to take questions, but we've got the presentation in the pack.
Thank you. I just want to make a comment on the presentation. I thought it was really a really excellent presentation, and I think members should be aware that not only do we have worsening a lower death rate, but we also have marked worsening health in the last years of life. So what I mean by that is that somebody on the Isle of Wight will have 8 years of poor health compared to a lot lower rate on the mainland, as far as just over the water. And those years of poor health are very service dependent, and that is obviously of importance to us. Thank you. Question from Councillor.
I probably should have said that declaration of interest that I'm a personal assistant with the PA Notice Board.
My view is these things should always be expressed and, you know, over-expressed and under-expressed. Thank you. We'll make a documentation of that. Thank you. Any other comments?
So I suggest as we develop the JSNA, what I'll do and what is send email updates to board members so that can be disseminated through your organisations. If helpful, I could do one from this morning that we could pass through to colleagues.
So in which case I'm going to move this on to item 7 now, which is the terms of reference for the Health and Wellbeing Board. And I think I'm handing over to you, Simon.
I have the joy of...
Of course you can.
Why do we have 8 years of poor health?
There'll be a number of factors in that. So quite a lot of that will be about the population. We know the kind of building blocks of health. So we know that if there's higher unemployment, if the education isn't as good, if the environment isn't good. So there's many factors around people's lifestyles, and then smoking rates. We have a high rate of smoking in pregnancy, so that will impact on the start of life. So there are kind of many multiple factors that mean that as people get older, they are less fit, and we need to do a lot of work, I think, around that. I'm not quite sure what the right phrase is, so forgive me. Preparing for old age. So actually, we really help people think in there much earlier than they may normally. So not just about what do I need to adapt my home when I'm struggling, but how can I maintain my fitness and think about those things as we get older.
Thank you, because I think that's really important that certainly councillors, we take that forward in any information we give to our residents.
And I think for a point of accuracy, we'll just check exactly the number of years, but it's a significant proportion. And obviously with our older population, that also impacts on having poorer health, because older people obviously do get chronic diseases, but it's often related to our deprivation, and it is multifactorial, as Simon said. But I'll check. I have to put that for an action for me, Sarah. I didn't want to say a figure in it to be a little bit off.
Accurate enough.
Thank you. So thank you for that. Now we'll move over to terms of reference.
So the Health and Wellbeing Board is a committee of the council, however, it's a different committee, and we need to make sure that the Health and Wellbeing Board terms of reference are updated, particularly in light of new developments. So I'm going to get the name wrong, sorry, Michelle, the Health and Care Partnership, which is a new meeting on the island that many people are part of, and that's about planning health and care. We have also, since these were updated last, we have the ICB, so we need to reference that. So what we need to do is just make sure we have a terms of reference that colleagues around this table are happy with before it goes into the constitution, recognising, so it needs to recognise the ICB as an entity. And also I think we need to think carefully going forward as the Health and Care Partnership gets more momentum, that what does this board do that's distinct from the Health and Care Partnership? And I would suggest there's something about the JSNA and something about one of the items later on about regeneration, but it may be that the way this board works moves forward in a different way. Welcome comments. And as part of this, could I ask Sarah from Democratic Services to email out and be really clear, because of change of organisation, who the members are and who your nominated deputy is from each of the organisations, because then we can get that correct, if that's okay.
Thank you, Simon. Any questions on that?
Thank you, Chair. It sort of feeds into this, but there is a relationship, a close relationship between the Health and Wellbeing Board and the Isle of Wight Safeguarding Children's Partnership. So I think we're aware of that. And I don't know if we have had a new protocol through, but I actually raised this and I had an email back to say that there hadn't been a review of the protocol since 2019. And a paper was going to be produced on the 27th of June to be.
So I've worked with colleagues in Safeguarding Children's Partnership. There's something about what's the role of this board as opposed to Safeguarding Partnership. The Safeguarding Children's Partnership is a very strong partnership as well, and all the members are almost the same. So it felt like one board was telling another board what they were doing. So what we've agreed is that they will share their annual report with this board, but other than that, there's no need for us to kind of step over each other's toes. But certainly, and I think the same for Safeguarding Adults Board, it would come here for noting, but we don't need to do anything stronger than that. If you're happy.
I understand it's a protocol, but that is that embedded? I didn't see that in terms of, I might have missed it.
Not in here, no, because I need to talk to Chris Potter, but I don't know if it needs to be embedded here. If it does, we can. If not, we can just talk to, there's something in place.
I think if we're reviewing the terms of reference, it would be useful to actually have that in there as a protocol. Thank you.
So you put that as an action and bring back.
Yeah.
Thank you. We'll have that noted as an action. Thank you. Any other points anybody would like to raise? Thank you. So if I now move us on to item 8, which is the mental wellbeing plan and suicide prevention action plan, who is going to?
Sorry, I'm just very quickly going to introduce. So we've had a mental wellbeing plan that was noted at the board in January, but my colleague Sue Cochrane, consultant public health, is going to present that. And we've worked very carefully with lots of different partners, but a great opportunity to discuss that as a key issue going forward. So you'll need a microphone.
Thank you. Yes, so we did bring it earlier in the year, and it is now a finalised plan that we're bringing here, both the mental wellbeing plan and the suicide prevention action plan, which wasn't cited back in January. And moving on from Simon's top item on the JSNA, if we look at mental wellbeing on the island, we know that it's a mixed picture. So we can see areas of vulnerability during the COVID pandemic around those urban areas, due to mostly the younger demographic impacted by COVID restrictions. But now, if we look following that, we know that we're seeing increased risk of social isolation in Shanklin, Newport and Ventnor. And we have gone out and asked people across the island what they think around their mental health and wellbeing. And there's things like worries about family, work, loneliness, not sleeping, but also thinking about some of the positive aspects for their mental wellbeing, that living on the island, there are a number of assets. such as nature, family time, animals, those kind of things. So the mental wellbeing plan is absolutely not about our mental health services. It's about the prevention of mental ill health and the promotion of positive mental wellbeing, also bringing in that absolute priority of preventing death by suicide on the island. And in that, it is owned and overseen by the Mental Health and Suicide Prevention Partnership. So it's a partnership plan for the next 5 years that's defined 5 separate priorities that you'll see in your papers around an absolute commitment for partners to think about prevention and early intervention, to focus on and build resilience, reduce stigma and discrimination, focus on suicide prevention, and to think about those inequalities and wider determinants that Simon was talking about in terms of those building blocks for health. So also included in your pack is more information about the Suicide Prevention Action Plan, and that is the key priority for the Mental Health and Suicide Prevention Partnership this year, thinking about what we can do not only at the moment, but focusing on what we know will be released later in the year around a national suicide prevention strategy that's due in September. And we've made quite a few strides on the island in terms of suicide prevention. So we're building on absolute strength in terms of we now have a suicide bereavement support service. We have a mental wellbeing communications plan developed. We have a strong mental health alliance with over 40 members across the voluntary and community sector. And we've done a relative amount on workforce development, thinking about things like suicide first aid training. So this is absolutely to note that we have a plan in place. If you go into the depths of the plan, you'll see that it's separated into now and next actions to enable us to absolutely think about what we need to do now. And we have a mental health alliance planned for the autumn, focused on building strength across the suicide prevention actions, as I've said. So it's for noting, and hopefully that gives a kind of brief description so far.
Thank you very much.
Can I just ask a question? I think we are aware from the statistics that mental health has deteriorated, as you alluded to. Are we confident that we've got capacity built in, and also that our thresholds are right? And I talk, sadly, from some personal experience.
So as I've alluded to, this plan is not about mental health services, so I can't talk about thresholds for services because that's absolutely not kind of the point of the mental wellbeing plan. What we're trying to do is to build capacity to strengthen the upstream interventions that there are. So we are doing a lot of work about ensuring that we have suicide first aid training available for people, mental health first aid training. So capacity building for that, yes. We have a 2-year contract with our learning development team in the council to ensure that there are sufficient spaces to really build that capacity, as well as using the alliance to think about not just learning how to use the theory behind the training, but using it. So there's kind of some work planned to bridge the gap into capability.
Because I know it's one of those things, it's the ripple effect, isn't it? And it affects families very much. So I think it's really so it's good to hear that, but we need to know that we've got the capacity, not just for that individual, but the wider context of helping the family to support.
And I think if I'm allowed to just come back, one of the things that's in both the mental wellbeing plan and the suicide prevention plan is the fact that there is still stigma around both of those things, and that you don't need a paid training course to empower yourself to break down that stigma. So there's free Zero Suicide Alliance training that Simon and I are working both on the island and on the mainland, asking everybody to undertake it, and that would be my ask of the board today. We can give you the link to that training, go away and empower yourself with the skills to say, actually, let's talk about mental wellbeing. Are you okay? These services are available for you if you're not okay.
I'd just like to say I have done the Suicide Light, which was excellent training.
Simon and Darren.
Yes, so as Sue said, one of the asks, particularly across the ICP, which we will assess, if we could all ask, and I recognise we're not mandating it through our organisations, to encourage staff to do the 20-minute online suicide prevention training. And we'll do that as part of World Suicide Prevention Day in September. So there'll be some comms coming out for staff around that, but recognise we're not, I can feel Nikki Turner online going, you ask our staff to do more mandatory training, but it's an ask that people could want to do either as a citizen or just as a member of staff.
Darren?
Thank you. Thank you very much. Really good, and support this completely. I've got a question more around some of ways of promotion and involvement in this, and it's really just a question of how might we do that to its fullest extent, really, given the importance of the topic.
We ask everybody to do, as we've said, to undertake 20 minutes of free training around suicide prevention and not be scared to use the word suicide. To do the same about mental well-being, and I can give you all the links to do that. That's the easiest thing we can all do, and to integrate it into part of our everyday life. And working with our NHS partners to also understand how we can integrate prevention across the other bits of mental well-being work that's happening, be that in the council, be that in our health services, to make sure that when we see people potentially for a physical health need, we're also thinking about, are they okay in other ways? So it's about us all chipping away at bits of our own behaviour and making sure that then that stigma is broken down.
Come back in. I think one of the things that we need to consider more generally is how more people know about what we're doing and the involvement in it. And I agree with all of what you said, but there's almost a general public information and communication aspect to some of the things that we're going to need to do. And that's the bit that I think we just need to think about next steps. Not all about everything, but there are certain things that we can do through that. And I think we probably just need to go away and think about how we do that to promote this more widely and get understanding and awareness in our population. But totally support this. It's great. Thank you.
We have a multi-agency mental health communications group who look to promote mental well-being and ensure consistency of messaging, because what we want is a single message. And we've also worked with I'll Find It to be that single port of call for navigation. So there's absolutely those motions in.
Thank you so much. Just before Nikki's got her hand up, and then I'll come to you. If you a little bit nearer the time, I'll engage primary care into sending out comms to all the primary care and see if we can get that 20-minute training done for you. I do agree with what Darren said, though, is members of the public, and with social media and all of those comms that we've got available, we could do a campaign around about that day that you mentioned in September, and we can really promote that and get that sorted. But I'm really happy to support primary care as a point of view. I'm a very good nag. Darren. Nikki.
Yeah, I was just going to echo what Darren and you have said. Really, we'll absolutely commit to do this. I noted Simon's cheeky comment about the additional training. This is really important. But I do think there's an opportunity through the healthcare partnership, through our connections, maybe through a health and care conversation. That was a piece that we used when we developed and refreshed the health and care plan, maybe using something like that to encourage many more people to actually undertake that training. I'm happy to link Kirk in to facilitate some of that as well, Simon. So just link with me afterwards and we'll sort that out.
Thank you. Thank you very much for this. I was particularly picking up the point around children and young people. So you acknowledged sort of adverse childhood experiences, and the plan also talks a lot about resilience. And I wanted to ask a question about the kind of plans. Are there any plans in engaging, I know schools are mentioned, but plans for engaging schools and other universal providers in that kind of resilience building, coping skills building work that they might undertake? As a provider of services, we have noticed a huge increase in our young workforce's inability to cope with receiving basic instructions to do work. So their emotional response, they're overwhelmed by things that we cope with on a daily basis. It's really visible that resilience isn't building in children and young people that we used to see 10, 20 years ago.
Thank you. So we do work with schools through the PEACH programme, which you may or may not be aware of, but that's around, I have to remind myself the acronym, Partnership for Education, Attainment and Children's Health. And both mental and physical wellbeing are absolutely key to that, particularly in using a whole settings approach to thinking about it. So not just focusing on those individuals, but really thinking about what it makes to build resilience. And that is the community that sits around that school, but also the community themselves. So that initiative is the key way in which we try to achieve some of the things that you have been describing, as well as making sure that we have key partners on mental health and suicide prevention partnership, such as the Youth Trust. I don't know if someone was that.
Thank you. June?
Yeah, I think all town and parish councils and their clerks would be very interested in receiving the link for the training, because we have a lot of people calling in to see us, and we need a skill set to help in this very delicate area.
Thank you, Joan. I think that's a really, really important point, and thank you for raising it. Councillor Stevens?
You beat me to it, actually, because I think that the Isle of Wight Council membership for the elected members could do well with the 20-minute training to gain an understanding. I think that within the council chamber in September, with a given date, we should be actually inviting all members to attend and take part in the training, be updated, and make sure that they're equipped to assist their residents, much the same as the town and parish.
Lead by example. I love that. Thank you very much.
Who will send out the link? How will we get that? Will you just send it to the membership? Thank you so much.
I think it's fair to say that we need a plan for this, and we need to, you know, how it's all going to work and the comms, and we'll leave that to Simon and Sue perhaps to do that, because actually it'll need a little bit of planning, but appreciate the enthusiasm in the room today.
One more bid. If we can have the link, I can get that out to Chamber of Commerce, Federation of Small Businesses, also third sector partners as well, who some are here, some aren't. So we can actually get out to all and sundry.
It's something also for parents. I just think that that would be and I'm not quite sure how one goes about that, but parents often feel very difficult of how they cope with their child that potentially is saying that they're suicidal, and the support that's there, even if this comms going out could offer some links perhaps for that. I don't think they necessarily need the training, but there's something about they might look at that and look at the training, and if the training could include links for support for where they can go to get further support, I think not quite useful. I'm not quite sure how we go about doing that.
Just to add on that, we have Solent Mind currently providing a self-harm support service for parents and carers, noting just that it is a gap across the patch, and there's training for professionals in that as well. So I can send the link to that service alongside the communications and training that we've mentioned.
Wonderful. Are we all completed with that? Thank you very much. Thank you.
So I've picked up a couple of things here. So what I'll do straight away after the meeting is share the link to the 20-minute training with a little description. We are working with ICB colleagues around the comms, and I think that will be some short social media that every organisation can then adapt for its own and put their own logos on, and we'll use that. We'll work with comms colleagues in the Isle of Wight Council. So I think what we'll see is a push now from Health and Wellbeing Board members, that's great, and then another push in September for World Suicide Prevention Day. And I think that will really help us to think about suicide. And I'm just going to put a last plug, and the language used around suicide, we die by suicide, and those kind of language will be in that as well.
Thank you very much, and thank you for everybody's support with this. So I'm going to move us on now to item 9, which is the Better Care Fund. Who is presenting that? Ian, fantastic. Nice to see you again.
Thank you. Thank you, Chair. So basically the paper in front of you, colleagues, is in relation to two aspects. It's the update for the Health and Wellbeing Board in terms of our end of year template submission. So last year at the Health and Wellbeing Board, you signed off the plan. So the Appendix 1 is in relation to the outcome of that. So it's the end of year submission to make you aware of what the final outturn was. The second aspect is obviously in relation to our proposals for the use of the Better Care Fund for the next 2 years. And just to highlight, it is a 2-year plan now, not an annual plan. So that's a change that has occurred in terms of the planning process. So I'm asking in effect for this board to please review, to receive it, to note the information that's contained within the appendixes, and where necessary, when we get to the end, to approve the requirements for the new 2-year plan. So I think there are some things just to note on this, and the paper, the covering paper, provides you with a brief background for those that aren't familiar with the Better Care Fund. It provides you with the detail in terms of what the planning requirements are. I think it's fair to say it's complex. It takes an awful amount of time and consideration, but this is created in partnership between the local authority and the ICB. In terms of the plan requirements, obviously we have to go through a quality assurance process with the national body who receive this, and will confirm whether the plan, the aspirations for the island are acceptable. And because of that, this is why it has to come to the Health and Wellbeing Board, because it has to have the statutory approval of the Health and Wellbeing Board to be able to be fulfilled. So in terms of the appendixes, I think I'll just touch on the 3 appendixes, if I may. So the first appendix is the end of year position in terms of what we plan to do and what the outturn of that was. So you'll see from Appendix 1 the final position in terms of the funds that were allocated against each of the elements. In terms of Appendix 2 and Appendix 3, one is in relation to the narrative. So we have to provide a narrative in terms of our plans, what it is that we're proposing to do with the Better Care funds and how those will be allocated. The third appendix is the actual planning template that we have to complete, and that provides the detail of where the spend is likely to go to. So I think in terms of the 2-year plan, my commentary around it would be, we're obviously clearly focusing on the agenda for integrated and aligned pathways. This is seeking to address the avoidance and the pathways that are needed to aid flow and provisions for the island. It is also seeking to preserve the great work that's been going on already in relation to prevention. So an example of that will be the Live and Well and early help provision. And this is about the system partners shaping the sustainable provisions for the future on a backdrop of, I have to say, a very challenging financial position, particularly with funds that are received and how we can utilise those to the best effort to succeed on the island in terms of our provisions. So without further ado, the ask really is the recommendations that have been put on there, and there are 5 asks of Health and Wellbeing Board, 4 of which are to note, and then the final one is to approve the 2-year plan that's been drafted. Please also note that obviously in terms of point C, because this is a fluid iteration and because of the Health and Wellbeing Board meetings, there is ongoing work that is occurring around the plan. So the final submission is being created, and it's to note that there is a request in here in terms of our Director of Adult Social Care and Housing Needs and the Managing Director of the ICB to have some delegation to enable us to do the relevant submissions when we need to. So I'm happy to take questions, Chair, but that's basically a summary of the report.
We'll take questions and any comments, and then we will ask if we're happy to approve the 2 points that you raised, one being the delegation and the other for the 2-year plan. Laura.
It's just a point of clarification, and I'm hoping the monitoring officer might be able to help us. The report asks that we note the delegation. I think that the board needs to make a decision rather than to note, so that recommendation may need a correction. Apologies, Ian, for not catching it sooner.
It's actually, sorry, Laura, on the summary on the front page, we are actually being asked to approve the work undertaken today and approve the delegation. So it is there. So there are 2, but very well pointed. So we need to know what we're approving. So we're approving those 2 things. Any comments, other comments? Darren.
Thank you. Totally support this. And obviously I can't comment on delegation point because one of those person is me. Teams involved, great work. really good. So totally support this. Two aspects, as Ian said, the end of the year and the plan. I think important for the board to note paragraphs 20 to 22, which provide us a little bit of flexibility that we'll need to come back through health and wellbeing should any changes be proposed. 2 years is a long time, given where we are, and finances are difficult now, and I suspect going to be more difficult over the next couple of years. So having that flexibility as an opportunity to do something different should we need it to, I think is very helpful, just useful for the board. But the governance process will come back through this should any changes be proposed.
In which case, are you suggesting that we re-note it in a year's time in any case to see, yeah, at least, yeah, 6 months to review and then, yeah, fantastic.
In terms of the two issues that we've been asked to approve, I'm happy to agree that we approve both. I think whilst we have timetabling issues between Health and Wellbeing Board and BCF templates, we need to ensure that we give the right people the delegated duties to move things forward, and we shouldn't be putting barriers in the way to completing the BCF because our timetables don't fit. That's the kind of bureaucracy gone mad sort of issue. So I think this provides us with the flexibility that we need.
Completely agree with that. So I'm assuming I'm happy to approve it. Wendy's happy to approve it. Would you just maybe raise your hand if you're happy to approve it? Unanimous. Thank you very much. I'd like to move us on now to item 10, which is health inequalities. And I understand Councillor Ashman is going to present us on this.
Yeah,
Chris, sorry.
That's all right.
Oh, apologies, sorry.
That's all right.
So many
That's all right,
changes,
Chair.
I can't keep up.
Yeah, you're second guessing my future career moves.
Oh.
Thank you, Chair. Thank you, Board, for obviously considering this paper today. It's a follow-up from previous discussions at this board regarding the impacts of place and regeneration on health in particular. And what the paper seeks to do really is to draw out that analysis, building on your earlier agenda item in terms of the JSNA update in particular, and obviously your terms of reference that were also earlier discussed on this agenda. So what the paper does is really reflect on that interdependency really and crucial impact of place on people's health and well-being, both mental and physical. And whilst that may be self-evident, it's sometimes best illustrated in a coordinated and strategic way. So the various elements in relation to place, obviously housing, employment, the relationships with communities are all fundamental to that physical and mental well-being, as we all are aware. The challenge is how the deficits connected with each of those in terms of the quality of housing, in terms of people's interactions with their community, in terms of their pay. How were those actions best addressed to those who are experiencing deficit? So we've struggled for some time here on the island to obviously get to grips with that issue and continue to do so. The paper talks around the current landscape around some of those interventions, the excellent work being done by Living Well, the work that's been going on around place planning, which to be frank is focusing heavily at community leadership on physical issues, so access to open space, improvements to local amenities, etc. But what the paper seeks to highlight is that really requires a more coordinated approach between the different parts of the system, as you might describe it, and to actually focus on particular parts of the island in a more coordinated way. Agencies, as we're all aware, struggle to do that in financial circumstances, difficult financial circumstances. So to adapt to the particular needs of particular communities, we struggle. So in that context, what this paper seeks to do really is build on that existing landscape. And what the recommendation of the paper suggests is that a whole system place wellbeing plan approach is piloted on the island, so that we can actually take account of these different factors, understand what the current need is in relation to the island and national averages, and to target interventions to tackle those needs from across the system. So it does require a fairly significant commitment by the agencies on the board to collaborate together to focus on that. And obviously it's for discussion and consideration this morning. And obviously we can then take forward that if the board so wishes. Thank you, Chair. I'll take any questions.
Can I just clarify with you, you're asking us to approve this, or is to consider? Thank you. Simon?
Chris, I really welcome this, and I think there's something about, as we kind of mentioned, I don't know if you're in the room before, mentioned earlier, the purpose of this board, I think, could really be strengthened if we think about the relationship between regeneration and health. And I think that really gives it the distinction. I think we've got a really unique opportunity to be here as an island to think about how we do that and think about those people who may have poorer physical and mental health and how regeneration may help them in terms of improving health. So thinking about employment, thinking about those things, linking back into the NHS services and primary care. So I think we've got a real opportunity to do it. Thinking about those factors that really impact on health and where we want to focus in terms of geography, say from the JSNA, but also maybe on certain conditions that are more prevalent here and how we do that. So I really welcome the opportunity to work together.
I was very lucky to do a course on the LGA conference about place-based inequalities for Providence Health, and interestingly enough, it says 400 billion is spent on public services specifically for England per year, around 100 times the amount that's spent on specific levelling up interventions. And I think that's what we've been talking about here with the Isle of Wight. We need to make sure that we look at those interventions and we're targeting the right people.
Thank you for those comments.
Thank you. And I think it ties in nicely with some conversations we've been having as senior leaders through the system with Darren, yourself, Michelle, Maggie at the ICB and Laura, where we've been considering how we can move to away from a reactive, acute-based funding system to a preventative system, recognising that at the times when people come through our front door, they already have issues. They already have a set of needs, and some of those are incredibly complex. And what we need to do is we need to move downstream of those people and start to look at how we identify those who may be likely to be in need in the future. And that ties in with what Simon was saying earlier, knowing about there are usually a range of things that are affecting people that make them more likely to have health issues. That may be related to employment, it may be related to earnings, it may be related to housing condition. And so I think that opportunity to also look at how do we identify that cohort of individuals? How do we start to wrap support around those individuals early enough so that we start to take some cost out of the system earlier and reduce the high demand at the front door? So I'm happy to kind of take this proposal forward, but I think we need to tie it in with that work as well.
Very much agree.
Thank you very much for this. And I guess we're asking the Health and Wellbeing Board whether we support the principle of a pilot and the principle of a focus on specific areas identified in Janice. Can't even say it. Anyway, I strongly support that. I just wanted to ask in the context of the proposed response about whether there's an opportunity to strengthen the response in the physical environment. So we talk about services, talk about anti-poverty strategies, and kind of integrating into other strategies and systems. But just with apologies to Debbie, I've got Sandown in my head. And just thinking about the physical environment at Sandown, thinking about empty buildings, disused properties, and other infrastructure, including estates that the local authority holds. Is that something that could be pulled in as a specific priority?
Yes, so absolutely. So I've just appointed someone in my team who's looking at place and health together, because actually we know that they're related. So how do you improve a place? And whilst public health isn't a statutory constituency on planning application, the large planning, we do work with Chris's, I think it's Chris's team, on the planning to make sure that health is considered. So yeah, absolutely.
Thank you. I completely support the proposal in the report, but I'm also conscious that as a system we have multiple strategies and diminishing resources and significant pressure in other areas. I think if we do agree to progress this, we also need to agree to prioritise our resources, because this has the ability to have possibly some of the most significant impact for island residents of any strategy we've ever implemented. And if we don't prioritise it and treat it simply as another strategy, we run the risk of an emperor's new clothes scenario and tripping ourselves up along the way. I think if we get this right and focus on regen people and regen place together for Isle of Wight residents, we could actually reduce the number of other strategies we've got floating around all over the place and stand to have a really big win. But I do think we need to recognise the impact that this will have on already stretched and limited resources, and the need collectively as system leaders to agree that this is going to be our priority moving forward.
Thank you, Chris, for presenting this, and Simon, obviously absolutely critical, and it's linked to everything we do. And Laura, totally support what you said there. My comments were going to be a couple. The first is, this is the plan, isn't it? This is the strategy about place, people. So that's what we need to adopt today, and that prioritisation of resources is going to be absolutely crucial for us. I had a lot of questions about how we might do this, but that's not for today. That's a question of outside and taking that forward. And I think the other point that I just make is several conversations have started, haven't they, about town and parish councils and their own place plans. And I think using the infrastructure that we have on the island, as well as the Isle of Wight Council, will give us an opportunity to reach more and possibly sooner into our local communities to do more together.
Thank you, Darren. Ian?
Thank you. Can you hear me? We're not going to jump straight in there. Laura has virtually said what I was going to say, but I'm not going to be outdone. I'm thinking about the resource, and I'm thinking about how stretched we are at the moment, what we've got in place already, how we can link that into this. And I'm all for it, but everything comes at a cost. And we've got to look at the cost that we're of the actual projecting this forward, but also there's a thing that says at the back of my mind we can't afford not to, which is a little bit that comes is nagging at the back. But I take on board what was mentioned about the built environment, but it's the unbuilt environment, the areas that we deal with on a daily basis in adult social care with regards to housing, temporary housing, funding and homelessness. And that's the unseen, but it creeps up on a surgery's doorstep or even elsewhere, because the damage has already been done. And I've said a couple of times in council that every child in temporary accommodation has got that has got that pressure on their mental and emotional well-being. And we're trying to educate them as well, trying to keep them, or bring them forward as responsible citizens. But we're fighting a losing battle because once again, we're reactive rather than being proactive, which is what's been said already. I really feel that I'm for it, but I see that we're doing things out there already. It's pulling those things together. It's the resource, it's the funding, but we can't afford not to do it.
Wendy?
Thank you. I mean, having listened to what everybody's said in terms of commenting on this, I don't think there's any disagreement that taking this approach is the right thing to do for this board and for every partner sat around this table. I think what we're saying is we need to do it in a way that adds value to what we're already doing, not create something new. This is not a new strategy. This is there's loads of good stuff already happening. We need to tie it together better, and we need to get those connections to work better and to demonstrate collectively that what we're doing is the right thing for the way forward. So I wonder if the action coming out of this is to agree as a principle that we support the approach, but ask for some work to be done on what that would look like in terms of how it starts to pull those linkages together, how it would report back to the Health and Wellbeing Board, and take it forward in that way. So continuing to investigate it and what it looks and feels like and what the shape of it is at the moment. And I think that means that we can understand the resources issue at the same time as well.
Emma?
Thank you. With Chris's imminent departure, who's going to own this?
So we will be moving to a new structure which sees a director of communities that will be appointed for the council. It would sit under that director leadership, but I think what we need to do as part of this investigation is agree who the lead partner will be and how that will work. Because the other thing that I don't want to happen, and apologies if this comes across as slightly challenging for partners around the table, but it's not just the council that is leading on this. We have a role to play, but other partners are equally capable of leading parts and elements of this. And I think this is the one where we have to get that bit right and we have to drive it forward in the right way. So it will hand over, our new structure starts on the 1st of October, hand over through to our Directorate of Communities. But I think at that point, we also need to agree the collective ownership of this as well.
Emma?
Thank you. Wendy's just stolen my thunder. I was going to talk about accountability, and that one of the things the board and its members might want to do at the next phase is to agree what that accountability looks like.
Simon?
So I was just going to add to that. Excuse me. I think following the earlier conversation about what does this board do that's different from the Health and Care Partnership, I think this really gives us we've got the right people around the table to work forward with our key agendas. So I think I'll work with Chris, trying to think. So I think we've got great health strategies, great agenda strategies. Let's bring them together. The wellbeing strategy again was great, but actually it's part of the whole thing. So how do we do that? I'm very happy to take the kind of public health leadership, working with Chris and others. So I'll be asking again questions of your organisation to say who can we connect in and have those conversations. Also recognising, looking at Darren and perhaps Nikki, it's not a normal conversation you have around regeneration. So we might have to tease that out over time and work out how that plays in. So very happy to play my part in that space. Michelle.
Thank you, Simon, for the support. We say farewell to two of our colleagues. Farewell. Yes. So moving on to the final item, which is members' question time. I'm understanding that they should have been submitted prior, and I'm not sure if we've had any submitted prior. No.
I would take members' questions, but
It's just
Debbie. I've not got my glasses on, so I can't see who's around the table.
No. Is there any other business? No? Well,
there was something, but it's so long ago that I've been trying to find it that I wanted to put onto this. I think, Wendy, you would have been copied in. I don't know if it was to do with SciCon.
What answer that, yes?
Was it to do with
It was
SciCon
SciCon,
and the
yeah.
backlog? I think it was, wasn't it? But I do think it's something that it would be very helpful for us to actually, if members think it's appropriate, for us to consider how collectively we can look at how we address the backlog. But I think, as we were talking earlier, it sort of feeds into that narrative of getting the message out to the public, because as we know, parents think an EHCP is the golden ticket, but what's needed is to get the assessments right and to get the right provision for that young person. So I think it would be useful if we could have an item on that to look. I don't know who would actually lead.
We've in the for the first time we've going to put it on the health and care partnership meeting.
As long as it's
there.
being...
It's definitely there, and I think the points you make are really important. And we were at the meeting with the MP as well, as was Darren. And there's something about, I think for me, the most important thing that came out of that meeting is that you don't need a diagnosis to get support. And that was absolutely vital, because actually you may be having difficulties, but actually you do not need, you don't get a diagnosis of whatever, but you need some support because you're still having difficulties. And I thought that that's really important that came out. And I think that's something about sharing that information. But for your, just so that you know, it's on the Health and Care Partnership Board agenda.
As long as it's being dealt with.
Yes.
But I think it's absolutely crucial about early intervention, that the early signs are recognised and that support is given at the early stage.
Absolutely.
Rather than waiting until it's progressed and picked up later on.
Yes, it's that proactive and not reactive. Thank you for raising that. Any other points? Fantastic. So it's 10:28. Close this meeting. I'm not going to do the hammer thing. I don't think I'm allowed to do it anyway. So I give you some time back and wish you a very nice rest of your day. Thank you.